NCLEX test-taking strategies. These are some methods to help you survive those NCLEX test questions. Tip number 1, read it. Yes, read your question very carefully. Read the situation and STEM question carefully. Try to understand what knowledge the question is asking for. Determine whether there is a true response or a false response STEM. So you're wanting to know, does the question want me to find something that is correct, or does the question want me to find what's incorrect in the answer choices? Be clear before you even look at your answer options. You got to understand what the question is asking you before you can look at your answer choices. If not clear, then reword the question using your own words. So figure out what it's trying to ask you, then reword it into something that's easier for you to repeat in your head while you're going through your answer choices. False response STEM. So STEM is the part of the question that is asking you for an answer. So this answer would be something that is an inappropriate nursing action or an inaccurate explanation. It wants you to find the false answer. So what in the answer choices is false? Look for negatives in the STEM. They indicate there's 3 choices that are correct and 1 is incorrect. The incorrect choice would be the answer to the question. So some words that you can pick up on that show a false response STEM are not, false, least, except, unlikely, all but, inconsistent, inappropriate, untoward, unrealistic, the lowest priority, atypical, incorrect, contraindicated, avoids, unsafe. So here are some key words that will help you determine that you would be looking for one of the answer choices to be false, and then that one would be your answer to the question. In a true response STEM, you're looking for the right answer. It requires an answer that is a true statement. So you're going to have 3 statements that are really not going to be the best answer. So you're going to find an appropriate nursing action. It'll say most essential, highest priority nursing action. It's a safe nursing judgment question, therapeutic nursing response, an accurate rationale for a nursing action, an action by a client indicating the success of nurses' client teaching. And then we have to decide. So once we figure out those keywords, is the question asking for a true answer or a false answer? So when I'm looking at my answer choices, am I trying to find the answer choice that's correct or most correct, or the false one? Does each response answer the question as a true or false statement? And don't forget to see which one your question wants. So what is your question asking you? Figure that out before you go to your answer choices, so your answer choices don't throw you off. Let's practice. So the nurse is caring for a client with urolithiasis, that is urinary stones, the nurse caring for a client with urolithiasis knows which nursing intervention would be inappropriate. So is this a true response or false response answer that you'll be looking for? Okay, so we have a key word, right? We know we're looking for a nursing intervention that would be inappropriate. So we're looking for something that is going to be something we don't do for this problem. So we're going to find answers that are things we do and things we don't do. So we can go through each answer choice. So would I force fluids for a client with urolithiasis, with urinary stones? I'm going to say Yes, I would. So that would be true. Would we strain the urine for someone who has urolithiasis? Okay, I'm going to say yes, because we want to see the stones, right? Something, yes, we would do that. Do we want to do complete bed rest? Well, I am not sure. I know that a lot of times we say complete bed rest is never a good thing for anyone. So I'm going to put a dash there. And medication for colic or discomfort. Okay. Well, let me think about what I know for this. Would we give medication for discomfort? And maybe you don't know what colic means. Colic is pain, a form of pain. So medication for urolithiasis. Will we give pain meds? Well, I know that urinary stones can be very painful. So yes, we'll give medication for that. So now I have 3 correct answers and 1 incorrect response. So, but the question wants to know which one would be inappropriate. So the correct answer would be your false response to that question. So we're not going to do complete bed rest because we're absolutely going to do the other 3 things. Let's practice again. The nurse is admitting a client suspected of having diabetes mellitus. If the client does indeed have diabetes mellitus, the nurse would expect to observe, figure out before you look at your answer choices, what does the question want? Okay, we have a diabetic patient. We're going to expect to observe. Okay, so we need to find an answer choice that is true, correct? We would expect to observe. We want to know what signs and symptoms or whatever would be with diabetes. Okay, so let's look at our answers now. Now I know what I'm looking for. Number 1, shallow labored respirations. Not sure. If you're not sure, just put a little question mark. Increased blood pressure associated with slight periorbital edema. Well, I don't remember periorbital edema for diabetes, so I'm just going to put an X because I don't think that's correct. Number 3, periods of altered pulse rate. I don't know if that's really on the list for something you would suspect diabetes mellitus to have. So this patient doesn't have a diagnosis yet, but they're suspected to. And if the client does indeed have it, what would we know, would we see? So I'm going to say no for the pulse rate. And now I get down to increased urinary output. Oh, now that rings a bell. So we know that when someone has diabetes, newly diagnosed, they usually have increased thirst and a lot of urination. So that sounds really good. So I feel confident about that one. So now I put a question mark on number 1 because I wasn't sure. But I feel that number 4 is definitely better than number 1. So I'm going to put this one out. So now my question wanted to know what we would expect to observe for suspected diabetes. So definitely it's going to be a true response answer, and my answer is going to be 4. Tip number 2, use the process of elimination in selecting answers. You can usually narrow down to 2 choices, then utilize other rules to make your choice, like a global response, similar distractors, and similar words. So let's look at those. Similar distractors. When answers are grouped by similar concepts, activities, or situations, select the one that presents a different concept. So that means your answer choices are going to sound very similar. Like the same thing but worded differently. Here's an example. A female client has been treated for severe chronic emphysema for several years with bronchodilators and a relatively high dose of prednisone. Which of the following activities would pose the least risk for this client and in relationship to the side effects of prednisone therapy? Okay, so here we have a complicated question. There's a lot of information and we have a lot of things going on. So let's maybe look at some things here that we should probably pay attention to. Okay, so I know, let's put her disease. She has emphysema. She takes bronchodilators and she takes a high dose, excuse the typo, of prednisone. Okay, so we have emphysema. She takes bronchodilators and prednisone. Now, we want to know what would pose the least risk for this client related to the side effects of the prednisone. Okay, so now we have our information from the STEM, the least risk. So, then we got to figure out what all on the list is risky, which one poses the least risk. We got to know our side effects of prednisone. So let's think about our side effects of prednisone, and if I was a student, I would probably get my paper out and I would write down what I knew about prednisone. I know prednisone is a corticosteroid. It raises blood sugars for diabetics. It causes weight gain, fluid retention. It also can decrease the immune system because it's immunosuppressant. All right, so now I've got my side effects, and now I know I need to figure out what is the least risk for the client related to whatever these side effects are. So let's look at the answer choices. All right, we have shopping at the mall on a Saturday afternoon. Okay. Spring cleaning her two-story house, attending Sunday morning church services, serving refreshments at her 6-year-old son's school play. Okay, so we see a lot of things here that have to do with daily activity. So which one would pose the least risk? Does any of these things here have to do with being around people or cleaning your house? Maybe like this one, the immune system one. So if we're looking at shopping at the mall on a Saturday, okay, there's lots of people at the mall on a Saturday. Spring cleaning your 2-story house, that puts her alone by herself. Sunday morning church, lots of people here too. Serving refreshments at her 6-year-old son's school play, lots of people there. So do you see how these answer choices here are similar? These three. This is the only one where she's by herself. So what would be the least risk? Well, if she's around all of these people at these places and she's taken an immunosuppressing drug, that puts her at risk for infection. So we would choose number 2, the one that's different. The others are similar distractors. So you would eliminate those and pick the one that's different. Look at this example. In providing care to a client with COPD, the primary nursing consideration is to, okay, stop right there. We have a COPD patient. We want primary nursing considerations. What is important for these type of population? What's important for them? Okay. Now let's look at our answer choices. We know what we're looking for. What's the most important for COPD patient nursing wise? not to overtire the client. Okay, well, that sounds good, right? Plan adequate rest periods throughout the day. That sounds good, right? Because they can get winded. Give only low flow oxygen. Okay, that sounds good too. Allow the client to set the pace when walking. Well, that sounds good because we can't tell them to go fast, right? When we're looking at this, you have 4 good answers, right? They all look good. You got to pick the best answer. So what's most important with these? And we're talking about, in this tip, similar distractors, right? So would not number 1 and number 2 be basically the same thing? You're not going to overtire the client, and you do that by planning adequate rest periods throughout the day. And you alternate rest with activity, so this kind of is the same as 2. The only thing that's different and is more important is regulating the low flow oxygen, right? Because we can only give, 2 to 4 liters to a COPD patient so we don't overload their respiratory drive. So these things here all kind of go together, and one kind of umbrellas the other. So I would put number 1 would be the umbrella. Here's number 1, and then 3 and 4 kind of fit underneath it, right? If we're looking at it as an umbrella, this one sticks out. It's a little bit different. Similar words. If you don't know the answer, look for a global response. That is one that includes the others. Then try to eliminate similar distractors. If you still cannot choose, look for a similar word or phrase used in the stem and one of the options. Let's take a look. Tip number 3. Avoid selecting answers with absolutes in them. They will be incorrect usually. Those are answer choices that use always, all, every, never, only, none. Very rarely will these be your answers to anything. Very rarely. Like the complete bed rest. That's an absolute answer too. Very rarely would that ever be a thing. Tip number 4, communication. If you cannot communicate therapeutically, it is difficult to practice safely. If the question has a true response stem, only options that use therapeutic communication tools can be correct answers. You always want to use open-ended questions. You don't want to use questions that would give a yes or no answer. We want to elaborate on patients' feelings, validate them, and offer assistance. So here are some therapeutic tools. Giving silence is a verbal form of therapeutic communication because you're allowing the patient to respond to you. General leads, clarification. Oh, well, what, tell me what you know about that. Reflecting, whereas be reflecting on what their emotions are. I can see you're upset. Empathy, giving correct information, focusing, offering it yourself for assistance. Eliminate blocks to communicate. So these are where you want to use open-ended questions. So avoid statements that include, don't worry, but why? Those are closed-ended questions and they are not therapeutic. It does not validate patient feelings. Let's explore, let's talk about, those are nurse-focused answers. We want to try and have patient-focused answers. So these are considered non-therapeutic responses. So instead of let's explore, you could say, tell me what you know about this. Tell me what you don't understand. Those kind of questions are better than let's explore, let's talk about. That means I'm going to talk to you and you don't get a chance to be involved in the conversation. So here's an example. A 50-year-old woman is admitted to the emergency room with a diagnosis of acute myocardial infarction. She tells the nurse, "I'm scared. I think I'm going to die." Which of the following responses by the nurse would be most appropriate? Okay, so we are looking for a true response answer. We want to know what is the best thing to say to this person who thinks they're going to die, okay, and they're scared. Number 1 says, "Everything is going to be fine. We'll take good care of you." Number 2 says, "I know what you mean. I thought I was having a heart attack once." Number 3 says, "I'll call your doctor so you can discuss it." Number 4 says, "It's normal to feel frightened. We're doing everything we can for you." Okay, so let's look at number 1. When someone thinks they're going to die, is it a good idea to say, "Everything is going to be fine. We'll take good care of you"? Is that a therapeutic response? Generally, students would think that this sounds like a good answer. I'm going to put a question mark by it. Number 2, "I know what you mean. I thought I was having a heart attack once too." Sometimes students will think those kind of responses are good also. Maybe it sounds like empathy. Let's keep going. Number 3, "I'll call your doctor so you can discuss it." That is basically saying to the patient, "I don't want to talk to you about it. Let me go defer you to someone else." Number 4, "It's normal to feel frightened. We're doing everything we can for you." Oh, okay. Well, here's an instance where we're validating her feelings. Okay? And we are giving her confidence in us. All right, so now this one sounds really good. Let's put a check by it. Number 1, I didn't know, right? Everything is going to be fine. Do you know everything is going to be fine? Never say it's going to be fine for a patient. You don't know that. And we can't predict the future. So we'll cross that out. No. "I know what you mean. I thought I was having a heart attack once." Is that a therapeutic response? Is that a nurse-focused response or a patient-focused response? This is all talking about the nurse. Does not show empathy for the patient in that way, so that would be an X. So your correct answer would be 4. "I can see you're frightened. It's normal to feel frightened. We're going to do everything we can for you." So validate their feelings or give them an open-ended response. Another good response to this kind of question that you may see, like answer choices, would be, would be something like, "Tell me why you're frightened. What frightens you about it?" That would be an open-ended question that they could elaborate. My brother died this way, or something like that, or "I'm scared that the medicine might hurt me," and then that gives you a chance to elaborate on their fears. Tip number 5, priority setting. Examples of STEMs which select these priorities. They'll say things like the nurse's initial response, essential nursing actions, vital consideration in planning care. So it'll say, in planning care of such and such, what is the most important, blah, blah, blah. Give immediate attention to which of the following? The highest priority, best nursing judgment, most important. So these are things that want you to pick out the priority nursing response. So here's some guidelines to use. Your priority setting frameworks. Maslow's hierarchy of needs. So their physiological needs, their basic needs are first, food, water, shelter, and then safety things that receive priority. The nursing process. Do your assessments first. Do you have all your assessment data? Assessment, and then interpretation of your assessment, and then you're going to move on to your interventions, evaluations, and outcomes. Communication theory, focus on feelings first, like the other question we saw for therapeutic response. Focus on their feelings first. Use your open-ended communication. Teaching and learning theory focuses on motivation first and readiness to learn. Example. A female client whose physical findings suggest hyperpituitary condition undergoes an extensive diagnostic workup. Test results reveal a pituitary tumor, which necessitates a transsphenoidal hypophyseectomy. The evening before the surgery, Nurse Jacob reviews pre-op and post-operative instructions given to the client earlier. Which post-operative instructions should the nurse emphasize? Let's stop right there. Whoa, that's a lot of stuff in this question, right? You've got to pick out what the question wants from you first. Let's read the question again. Which post-op instruction should the nurse emphasize? Okay, we want post-op instructions. What is the most important post-op instructions? Okay, what surgery are they having? They are having a transsphenoidal hypophyseectomy for a pituitary tumor. Pituitary is in your brain, right? So she's having a brain surgery, correct? Yes, okay. We know it is the night before, and we're going over instructions. Now we need to know which one for post-op is the most important. Okay, we got it. Now we understand our question and exactly what the question is asking me. Is it a true response or false response question? I am looking for a best response. So it's true response, but they all could be correct because it wants to know which one should we emphasize. When we look at our answer choices, let's see. We're having brain surgery and we're looking for post-op best instructions, most important. A, you must lie flat for 24 hours after surgery. B, you must avoid coughing, sneezing, and blowing your nose. C, you must restrict your fluid intake. D, you must report ringing in your ears immediately. All right, so we might need to have some knowledge of cranial head surgeries, right? We might have to have some knowledge of brain surgeries and think about what would be the most important related to post-op care for that. Should we lie flat for 24 hours after surgery? I don't know if I ever have heard anyone ever having to lay flat for that long. So I'm going to right now think that this is probably not going to be my best choice. All right. Number B, you must avoid coughing, sneezing, and blowing your nose. All right. So we have a head brain surgery, and I'm thinking, why would we say this post-op? And, well, if I cough and sneeze and blow my nose, it increases pressure in my brain, in my head, and that wouldn't be good. So let's keep this one open. Not sure, right? You must restrict your fluid intake. When do we restrict fluid intake? Would that be related to after a brain surgery? Maybe, if they don't want to increase the amount of fluid in circulation, but maybe that's not the most important post-op instruction, okay? Post-op instruction. They may have lost fluid during surgery, so probably not this. You must report ringing in your ears immediately. For post-operative instructions, I don't know. Don't think so. I'm going to cross that out. So I'll list with this one, if the patient has coughing and sneezing or blowing their nose, it could increase the pressure, and that's something we don't want them to do that immediately after surgery. So that would be a good post-op instruction. That would be the most important. The others take more time, I believe. So you do have to have some knowledge of the procedure that's going on in the information and what post-op instructions would be for that kind of surgery. So sometimes you can't just figure it out. You have to have some of that knowledge that you studied. Remember that NCLEX questions are textbook and they're not real world, okay? They're not how we do things in the real world for the most part. Do not pass the buck. That means don't put the answer to someone else, like on the therapeutic response question. Don't say, well, I'll call your doctor and you can talk to him about that. Okay, that's not good. Avoid notify physician answers. NCLEX does not want to know what the physician will do. He wants to know what you will do, what the nurse will do. Very rarely is notify physician an answer. Sometimes it might be, but very rarely is it the answer. Make sure you know lab values and your normal lab values. You have to be able to correctly interpret normal and abnormal lab values. If you don't have that knowledge, there's no way you can answer a question about lab values. Make sure you know your rights of medication administration. That will help you answer questions. The last tip, and the biggest one, is those SATA questions. Those select all that apply. So hard. Tackle them one by one. Here's the secret sauce to answering SATA questions. They're actually a true-false question. They're true-false questions. Treat them like it. Therefore, you proceed to answer each option by responding either with a yes or no, if it applies or if it does not apply to whatever the question is asking. Go down the list one by one and ask yourself if it's a correct answer. Then look at the next choice and do the same thing. Next, next, next. Do not group them. Treat each response as a true-false question. Don't group them or link the choices together. Don't answer them as a group. Don't do that. You'll mess yourself up. Watch out for absolutes or extremes, like all the time, always, never, complete restriction. Those are usually wrong answers. If you cannot recall the information or if it doesn't make sense, it's probably wrong. Don't choose it. Okay? Do not change your answer unless there is something really obvious you've overlooked. For example, you overlooked that the question wants a negative response. It wants you to pick out the false answer. It wants you to pick out the true answer. It wants you to pick out what doesn't belong. So don't change your answer unless you obviously overlooked a question. There will usually be at least 2 correct responses, and it can be all of the answer choices. So usually at least 2 or all, 2 or more, okay? Here's an example. The nurse is planning care for a client with hyperthyroidism. Which of the following nursing interventions are appropriate? Select all that apply. Okay, so stop yourself and think about hyperthyroidism and what that is. You need to probably write yourself on your paper maybe your signs and symptoms of hyperthyroidism and whatever you can recall about that disease process, okay? You need to think about that before you go to your answer choices. So you have the recall of the information in your mind before you read your answer choices, okay? Pull the knowledge out first so you have your background before you begin to answer your question. So now you're going to look at each answer choice, okay? So you look at A, and A says, instill isotonic eye drops as necessary. So don't look at anything else. You're just looking at this. And you think to yourself, would I, it wants appropriate, so it wants true responses. Would I instill isotonic eye drops as necessary for hyperthyroidism? And you would put true or false. or a check or an X. Or yes, I would do that, right? Okay, go to B. Would I provide several small, well-balanced meals? Well, that usually always sounds good for hyperthyroidism. Would we do that for hyperthyroidism? Is that an appropriate intervention? Yes or no? Would we provide rest periods? Okay, do we provide rest? Well, they can get exhausted pretty easily. So yeah, that would be an appropriate intervention. True. Keep the environment warm. See, I'm looking at these individually, I'm not going back. Keep the environment warm. Well, in the picture I saw on the Picmonic, there's a fan. So that they don't want warm environment, they want a cool environment. So that's false. That's a no. Not going to do that. That's not appropriate. Encourage frequent visitors and conversation. Well, that kind of contradicts C. No. False. It's not what we would do for hyperthyroidism. Not appropriate. Would we weigh the client daily? Is that true or false? Let's see. Do we want to weigh the client daily? Was that a hyperthyroidism intervention? Yes. Okay, so now I have my answer choices. I've gone through all of them by themselves, and I've not leaned on one or another for my answers. So I have A that I picked that would be a good intervention, B, C, and F. The true-false intervention. So A, B, C, and F. So the client with hyperthyroid has exophthalmos, which their eyes stick out. So we need eye drops to help prevent dryness of the cornea. We have B and F, which the client experiences weight loss because of hypermetabolism. Several small balanced meals are given to improve nutritional status. Daily weight should be monitored. Weight is the most objective indicator of nutritional status. So when you're doing your select all that apply, make sure that you always, okay, true, false interventions. So now, I hope that these tips will help you answer your questions better, get you an NCLEX review study book, and practice those test-taking strategies on those practice questions. And in those books, they have test-taking strategies on how to answer those questions. And I hope this helped. Thank you very much for listening.